My name is Stephanie Blank, and I'm the Director of Gynecologic Oncology for the Mount Sinai Health System and a professor in the Department of Obstetrics, Gynecology, and Reproductive Science. I'm here today to provide information for women with gynecologic cancers about the COVID-19 and about how to deal with COVID-19. So if you're speaking as a cancer patient, women with cancer do want to know if they are at increased risk for COVID-19. And, unfortunately, probably women with gynecologic cancer are at increased risk for COVID-19. Actually, more importantly, if somebody with cancer gets the virus, they are more prone to have the more severe type of disease that goes along with the virus. So what are the reasons for that? Sometimes the cancer itself can be the reason why you might have a more severe form of the virus, and sometimes it's some of the treatments or surgery that you've had that can make your immune system weaker, so you can be more susceptible to the virus. So if you start feeling symptoms, what you should do is you should probably call your doctor and discuss those symptoms with your doctor. There's different availability of testing in different parts of the country, so it really depends on where you are and what the COVID burden is like where you are and what the availability of testing is. If you are having symptoms, I would say the most important thing, aside from calling your doctor and figuring out about getting tested, would be to isolate yourself and to take care of yourself, but to avoid other contacts and avoid exposing other people in your home to you. So women with cancer are asking me a lot, is it safe to go to my appointment? And actually the CDC has recommended that people do not go to the doctor for non-essential appointments. So I would say, to answer the question about if it's safe to go to your appointment, basically it depends on the purpose of the appointment. So sometimes an appointment is just something you go to every year for a checkup. Those types of appointments can easily be rescheduled. So it's not that so much that it's not safe to go, but that when you look at weighing the risks and benefits of going to the appointment, exposing yourself, to the travel and to the people that are there when you go to the doctor's office, is not worth the benefit of that appointment. So it really depends on the purpose of the appointment. So chemotherapy, as I mentioned before, does make the immune system weaker. So every decision about whether or not a woman is going to continue on chemotherapy for her gynecologic cancer, there's no blanket answer for this. So basically, each situation has to be really carefully weighed between the woman herself and her doctor. So it depends, first of all, on the purpose of the chemotherapy. Is it chemotherapy that's going to cure you? If so, you probably don't want to interrupt that in any way, shape, or form. If it's something that's controlling your symptoms, you may be able to sort of space out the interval between treatments. Again, you're not making this decision, you'll make it with your doctor. At our institution at Mount Sinai, we're now testing women for COVID before we give them any chemotherapy, and the purpose of that is because we know if women have the virus, and have cancer, they may get significantly sicker. So we wouldn't want to give them chemotherapy if we knew they had the virus. So that's one thing that we're doing here to make sure the chemotherapy is a little bit safer. Also, we are taking precautions to make sure that people don't have their blood counts drop very, very low. Well, again, that depends a lot on the burden of COVID where you are. So right now in New York, I don't really think it's safe to have surgery. We are trying to delay all the surgeries that we believe we can safely delay. And the reason for that is that, you really do not want to be in a hospital right now in the city. And that's one of the reasons why we're delaying it. Again, we're looking at the risks and the benefits. And in our opinion, for most cases now, the risks of surgery in this pandemic do not outweigh the benefits. We have had to cancel patient surgery, and luckily in a lot of cases, there are other options. So first of all, the first thing I want to say is sometimes it's safe to delay surgery. We're not talking about delaying it forever. We're talking about delaying it until sort of we get to the other side of the curve, if you will. And we do have data to suggest that it is safe to delay surgery sometimes. We do this all the time. Sometimes a patient wants to delay her surgery to, go to a grandson's graduation or something like that. And we do that knowing it's safe. Now we would do the same thing. We could delay a surgery because it's not safe right now. Sometimes if we think somebody has a new ovarian cancer, we may start with chemotherapy instead of surgery, and we know that's safe. We have a lot of data for that, so that's one option. There are some endometrial cancers for which it's you can be treated with hormones, and we will do that as a temporizing measure as well. Well, I think any kind of emergency would require immediate attention or treatment. This is not a situation where you have to make those decisions by yourself. I would say that one thing that all of us in the medical profession are really trying to do is to communicate with our patients and be available to answer questions, because just like when you have cancer, every symptom you have seems like your cancer is coming back. Well, you have that going on, and then you have COVID going on, where every symptom you have you think is COVID, and it's really a time of anxiety for a lot of people. So I think the things that would make you be more concerned about COVID, fever, cough, shortness of breath, those things, that would if you had those symptoms, you would call your doctor. If you had symptoms that you've been informed might be concerning for cancer and gynecologic cancer, those might be abnormal bleeding or bloating, you would call your doctors for those as well. Now, whether or not you would be getting emergency treatment or how that would be managed, again, I'm sorry to keep repeating myself, but that would be on a case-by-case basis. So I'm a huge fan of public transportation, but not now. I really have been trying to encourage my patients not to take public transportation. And if you have an option not to take public transportation, I would recommend that. If you have cancer and the reason you're going to your appointments would really be because you were getting chemotherapy or something like that, I would try to avoid public transportation. Let's say you do not have any option but public transportation. I would encourage you to wear a mask, to carry hand sanitizer, wash and be careful of what you touch, and obviously distance from people on the public transportation. Luckily right now, apparently a lot of the public transportation is a lot less crowded than usual, so you should be able to distance yourself even taking public transportation. So if your doctor canceled your appointment, the likelihood is that your doctor considered the reason for which you were having the appointment and considered the risk of COVID and exposure, and determined that the benefit of the appointment was not outweighed by the risk. So first of all, it probably means you're in a pretty good situation. But if you are concerned, there's a couple things you can do. Call your doctor and find out, first of all, if it was canceled indefinitely, or what the situation is. Another thing that a lot of doctors' offices are now doing, and we're doing, is using telehealth. So you can still have the conversation, discuss your concerns to your doctor without physically being in the same space as the doctor, and you could do it from your own home. And that way you don't increase your risk of exposure to COVID. So those are some things that I would recommend. If your doctor does not have telehealth, certainly the telephone can work, and you can get some information that way. So women with gynecologic cancer should do the same things that everybody is doing to stay safe, namely washing your hands in soap and water for 2 minutes, singing that happy birthday song 2 times through, avoiding touching your face, staying more than 6 feet from people when you go out, wearing a mask, and avoiding sick contacts. Those are just some really important things to do. And again, I mentioned trying to avoid public transportation, but avoiding public places, I would say, would be a very important thing to do. See if somebody else in your home, if there is somebody else in your home, can get your groceries or have them delivered or do something like that, just to do everything you can. Take these warnings really, really seriously about social distancing and about washing and disinfecting surfaces around and all those types of things. Please, everybody, stay safe and be well. Thank you.